Hi, my name is Zoe Dahl, and this is Northgate Sports Medicine Shoulder Long Eval. So first you start with history, so you ask the 5 questions. So what was the mechanism of your pain? Do you have any previous injuries? Are there any unusual sensations? What type of pain do you have? And what is the location of your pain? Then you move on to observation. So are there any obvious deformities? Is there any swelling? Is there any discoloration? Are there any cuts or abrasions? And then you bilaterally compare between both shoulders to make sure they're the same. Okay, so now we will move into bony palpation to rule out fracture. So you have your clavicle, you have your scapula, you have the lateral border of the scapula right here, and then on the other side, you have the medial border, and then the head of the humerus is right here. Then you have the glenohumeral joint, which is kind of your shoulder joint. You have the deltoid tuberosity, which is on the shaft of your humerus. Then you have the spine of the scapula, which you can kind of see if you kind of hunch your back a little bit. Then you have the acromion. Then on the back it's kind of hard to see, but then it's easier to see on a skeleton, but then there's the inferior angle of the scapula. And then you have your coracoid process, which is what you do. You can do a noxious stimulus. That's one of the places to do a noxious stimulus. Then you have the bicipital groove, which is on the head of the humerus. You have the scapulothoracic joint, which is kind of where the scapula meets the rib cage. Or the thoracic cavity. And then you have the shaft of the humerus, which is just the body of the bone. You have the greater tuberosity and the lesser tuberosity. And then your sternoclavicular joint is just where your sternum and your clavicle meet. And then you have the acromioclavicular joint, which is right here. And then you have your glenoid fossa, which is more inside the shoulder joint. Okay, so now we're moving into soft tissue palpation from least pain to most pain. Okay, so we'll start with the deltoid muscles. So this is the anterior deltoid, mid-deltoid, posterior deltoid. Then the pec major is kind of like all across the torso, like they're big muscles. And then the pec minor is kind of just right here. And then for biceps, we have the long head, which comes down here, and then the short head, which also comes down there, and the long head and short head of the biceps. And then obviously the biceps are like right here, and then the triceps are on the back, on the posterior side of your arms. Okay, so next you have your coracobrachialis, which kind of goes from your coracoid process down to here. And then you have your 4 rotator cuff muscles in your shoulder, which are the supraspinatus, the infraspinatus, teres minor, and subscapularis, and those are demonstrated by the acronym SITS. And then there's also teres major, which goes from kind of like right here down to the scapula. Okay, and for these last 3 muscles, we have the lats, the latissimus dorsi, which cover a large part of your back. They're one of the strongest back muscles. And then the rhomboids, which are kind of upper back, lower neck area. And then last one is the trapezius, which is another large muscle that covers some part of the area where the lats don't. And that's like the upper back neck area, because the trapezius goes into the occipital protuberance. So it's kind of like up here and then goes up onto your neck and then up onto your skull. Okay, so now for the other soft tissue structures that are not muscles, that are like ligaments and bursas and stuff. So you have the conoid and trapezoid, which are part of the coracoclavicular ligament. So they kind of go from your clavicle to the coracoid process, and then you have the conoid and trapezoid, and then there's also the sternoclavicular ligament, which runs from the sternum to the clavicle, and then you have your acromioclavicular ligament, which, as the names, all these names are kind of intuitive, so like acromioclavicular goes from the acromion to the clavicle, and then you have the glenoid labrum, which is like a soft tissue structure inside the shoulder that kind of cushions it. Coracohumeral ligament goes from your coracoid process to the humerus. Coracoacromial ligament, coracoid process, acromion. Serratus anterior are kind of like projectile-like muscles in between your ribs, and they are especially prominent in swimmers. That's the serratus anterior, and then levator scapula, just like elevate your scapula. It kind of says it in the name. And then joint capsule is kind of lubricates the shoulder joint, make sure it moves correctly. And then subacromial bursa is under the acromion, and it also kind of cushions the shoulder joint. Now going into ranges, specific test, ranges of motion. This is going to be active range of motion, which is looking for pain. So we're going to go through all the ranges of motion of the shoulder joint from anatomical position. So you have flexion, extension, and then internal rotation, external rotation, and then abduction, adduction, and then horizontal adduction, horizontal abduction, and then elevation, depression, protraction, retraction. So those are the active range of motion because I did them myself, and active range of motion is looking for pain. And then if I had another person with me, I would move them instead of them using their muscles, and that would be passive range of motion, so just moving it for them. And then passive range of motion is looking for pain and bony blocks.